just want to thank you. I just want to thank you for taking the time to join us for our first session of our Stem Cells and Autism educational webinar series. And over the next 3 weeks, we're going to walk through this topic together in ways that are clear and educational and helpful for families who are hearing more and more about stem cell therapy and want to better understand exactly what it is. And I'm really excited to have Jory Scott joining us, who has been working in the biologics and stem cell field for many years and will be helping guide us through the science kind of behind all of this. So, if you've ever tried to research this and felt overwhelmed, our goal today is just to help you leave with a little more clarity than you had before you came in. Um, so before we jump in, I just want to set the tone for this three-part series because the reason why I wanted to host these webinars is because over the past several months, many families in our Not Your Average Autism Mom community have been asking about stem cell therapy. Some of you have sent me articles, some of you have asked if I've heard about certain clinics. Some of you have simply said, "What do you know about this?" And I quickly realized that there's a lot of information online, but not always a lot of clear education for parents like us. So, the purpose of this series is really simple to help you better understand the topic so that you can ask informed questions and evaluate information responsibly. And I want to be very clear about something right from the start. This is not a sales presentation in any way. This series is just simply about education and understanding. Uh, so, you know, my story, for those of you, oh, I went one too far. For those of you who may be newer to this community, I just want to share a little bit about why this topic matters to me. I'm the mom to an amazing young adult named Jordan who was diagnosed with autism when he was 5 years old. So, like many of you, I've spent years navigating therapies and treatments and school systems and trying to understand what might help him live his best life possible. And that journey is what led me to create Not Your Average Autism Mom, which has grown into a community where we support moms raising children on the spectrum. And one of the things that I believe strongly is that families deserve access to clear information when they're exploring options for their children. And that's exactly what this series is about. Now, like I said, stem cells have come up again and again in our community, and we've been talking a lot about it. So some of you have asked, about certain things. So when I started looking into it, because so many of you were asking the same questions, what I realized pretty quickly is that it's a topic where there's a lot of discussion, but not always a lot of clarity. And I'm not a doctor, I've never pretended to be one. My role in this community has always been helping moms, families find clarity and better understand their options. And that's exactly why I asked Jory Scott to join us for this series. We're going to talk about all the things. So, Jory, I'm just going to say, I'm going to let you just kind of introduce yourself and you can kind of take over from here.
Okay. Well, my name's Jory Scott. I've been in the biologics arena for quite a while, probably since back in 2011, somewhere in that area, 2011, 2012. And started off in orthopedics. I have a background in athletic training and then a minor in psychology. And thought I really was going to go into sports psychology, and really didn't happen that way. Uh, Got off into orthopedics, selling orthopedic implants and surgery. Did that for probably 11 years. Uh, Learned a lot and just realized at that point, kind of got involved in the biologics through orthopedics and just realized at that point that uh, this was going to be the future of medicine. It was real easy to go through and look and tell that biologics was just a very unknown territory. And uh, just out of, I guess, just out of luck, orthopedic surgeons believe in stem cells. And at the end of the day, if stem cells brings uh, some closure to some things along the way. At the end of the day, I think everybody's going to need to thank the orthopedic industry because they are the ones who really pushed it when the FDA and a lot of companies were saying no. And so that's kind of how my background started. Started working for a company out in New York that has a patent actually. It's called direct sonication, and started working with them. Next thing you know, kind of got away from that, started my own lab, started doing my own research, ended up with my own patent. My patent is indirect sonication. And one of the only two patents that is available for cell therapy is that those two patents. And just kind of started in that, started treating orthopedics, then started looking at uh, really into diabetics. And then, of course, with diabetics came neuropathy. We started realizing, hey, we're doing really well treating neuropathy. And then neuropathy kind of led us into the things we're into now. So we still treat neuropathy. Then we started treating autism with a group out of Dallas, simply because we felt like autism and neuropathy had a lot of similarities. And then it's kind of floated on over into concussion syndromes, strokes, congestive heart failure. So that's kind of where we've ended up. We've ended up there really from following neuropathy, and we've just seen a lot of results. And that's where we are today.
Well, that's amazing. So I mean, I just kind of want to, I'll just kind of go through these slides for you, and you can just kind of highlight them, why families are asking about stem cell therapy and kind of what you're seeing in that area.
I think let's give autistic families some credit. They are relentless. They're extremely intelligent. Most of these families are so impressive because they understand what they're dealing with sometimes a lot better than some physicians or the nurse practice that they're dealing with. So that's kind of where this starts from. And, you know, you just look at what's happening in other countries and they start treating a lot of different things with stem cells or cell therapy or something that they claim is stem cells. And they do see some results. And so I think that's why families are starting to ask is because I think there's, and I don't think, I'm pretty convinced there's this idea in America that you can't get real treatment unless you want to go out of the U.S. because the FDA is not going to allow it. It's not going to allow it. And so the word stem cells really got promoted outside of the U.S. and trying to and get people encouraged to go out of the country to get treatments. And I think that's what started it. And it's just a craze. There's so much information out there, and at the same time, families are relentless and somewhat kind of hanging out there on a limb, willing to try things that everybody else isn't willing to try. So I think that's why we're seeing this in the autistic world. Is simply because the families are smart enough to realize that they're going to have to think outside the box. And maybe generalized medicine has failed us a lot in chronic conditions. And so I think that's why we're seeing the autistic families in this arena.
Perfect. And I know we're going to kind of get into the that part of it in the second session, but today we really want to talk about, what the stem cells actually are and how they function in the body and just kind of more into your realm. So, and for us as families, it's very confusing. And you and I have spent a lot of time on the phone talking about
Yes.
this, and even during those conversations, it's a little overwhelming. So, I want to say to everyone on here today, if it starts to feel a little overwhelming, just know you're not alone. But this is exactly why we're breaking it down step by step into three webinars because there's no way we could put all of
Yeah.
Jory's information in one. It's a
Yeah.
lot.
And I hope we clarify a lot of things. Uh, But I think why the stem cell market is so confusing is it's a lot of misleading information. Everybody wants to use the word stem cell, and I won't say 90%. Most of the people that you're looking at either really don't have stem cells or aren't proving to you they have stem cells. So the FDA, the real issue the FDA has is the fact that people are providing like a cord blood or amnin or something different, and they're calling it stem cell treatment. And we know it's not stem cell treatment simply because what's on the bottle that you're receiving doesn't say stem cells. It says something different. And that's where the FDA got in because they knew this was going to be confusing. And this is one of the times that I have to say the FDA probably got this right, is that they jumped on it on the front trying to eliminate the confusing part. The reality is a stem cell is one cell. And I don't know that anybody is providing one cell. So when you hear that word stem cells, what does that actually mean? Uh, there's so many different types out there. Uh, that's what makes it number one thing confusing is understand what are you actually getting. So I think to get to that point, you got to look at maybe the four major things that everybody's receiving, which is like cord blood, amnion, BMA, stromal vascular fraction, perivascular fraction, stuff like that, because that's probably 98% of what people are receiving, and that's what they're calling stem cells. And the reality is, uh, most of it really isn't stem cells.
Yeah, that's really interesting that you say that because yes, I had actually spoken with somebody a few months ago who was talking about it, but they're using what they're getting from cord blood, like you said.
Yeah. And
So,
cord blood's a great product. It really is. And I don't want to mislead anybody to think these products aren't effective. They can be effective. It's just I think you need to understand what you're actually receiving to understand what you should expect. And I think that's where a lot of the confusion is that's not being clarified. And it's not being clarified across all markets. And that's what makes it so confusing is there's no real baseline. It's kind of just, hey, if you're talking to this guy, he tells you this is what stem cells are. Or you look at this study, they say they use stem cells. We haven't found a study that's been released yet that actually releases the information of what cells they're actually using. And so it's even confusing in the scientific data and the scientific literature. We have to go back and look at what their claims are and start predicting what they're using, simply because they're confusing us. So if I'm confused, I know everybody else is confused, uh, just because it's too variant of an information. So
so could you just kind of, talk to me like I'm in fourth grade and explain to me, like, if you can see the screen where we're
yes,
talking about the different biological sources,
yeah,
cord,
absolutely.
the
Cord
differences in
blood.
these areas.
Yeah, and on the left side, there's the biological sources. And this is, and you and I talk, there's more than this, but this
Yeah.
is what most of the families, I think, in the autistic arenas are looking at, or they're being sold. Let me say it that way. Most will be the top three, but cord blood, is a really good product. The misleading part of it is how much the exaggeration of cell counts are. So if you take the average cord blood harvest, you're talking almost 3 to 4 cc's max, like 3 to 4 cc's of the entire harvest. So out of that, you're going to get somewhere between 460 and 540 million total cells. Well, only 1.4 to 1.8% of those cells are stem cells. So you're looking at seven, and I'm guessing 7 million total cells, uh, somewhere between seven and eight. Well, they'll divide that up into 40 to 50 different vials. So what they do is they take that 4 cc's and they spin it down with a centrifuge. and then they try to get it down to a pellet. So when they get that pellet down, they'll try to extract the other fluids off the top, and they'll take what's out of the bottom of that tube, and then they'll separate it and mix it into, let's just say, 20 cc's excuse me, of saline, and then they'll mix that up so you know it's divided out through the fluid evenly. And then they will take and separate that into 40 to 50 different vials. Uh, so if we started out with around 8 million stem cells, and you divide it into 20, not even 40, you're looking at 400,000 stem cells uh, per vial. But it's really getting divided up to 2 to 3 times that. So typically you're seeing around 100,000 stem cells in a treatment vial that's coming from cord blood. Um,
And talk to us about like the stems, the numbers that you're talking about.
mhm.
So what's good versus not good?
um, well, that's hard to say. And here's where we go. We're talking about numbers, and every different product has a different number. And I say that because the product that I developed, I've had doctors that have worked with me buy stem cells, quote, from companies out of California and get the same amount that supposedly I'm treating with, and they don't get the same result. So the reason is they're not the same product. You know, I want to simplify something for everybody. Stem cells are the same. If they're mesenchymal stem cells, they're the same. It doesn't matter where you get them from. If I tell you I have 4 million and this person over here tells you they have 4 million, and we go through the process delivery process or methods the same, we should get the same result. There's no magic there. It's all based on the numbers. So if two different products are claiming to be the same and they're not getting the same results, they're not the same product. And it's just that simple. And that's where it's going to eventually come out is as we collect more data, people are going to see results. And I think this is going to be a results driven industry before it's over with. And so it's hard to go on the numbers. So if it were me and I'm getting 100,000 cord blood cells, uh, and those probably could be infused, depending on how they're strained and treated or filtered. Um, I wouldn't expect a lot. Uh, I don't know that I'd expect to see anything, to be honest. I might feel better. I might not get headaches quite like I did for a couple of days. I don't see that being what I call a therapeutic number. And so that's where I would go with this. What you're hearing in Mexico or somewhere else, and I don't want to point anybody out, but what you're hearing out of the country is they're giving you 60 million cells, or they're giving you 120 million cells, or they're giving you 230 million cells. Those numbers are almost impossible. And, uh, you and I have talked about the delivery method. If I am somewhere that I'm being told I'm getting 60 million cells and it's going to take 15 to 20 minutes, I can tell you immediately it's not 60 million cells because you would absolutely walk up the lungs with that many cells to the point you probably wouldn't survive as an adult. So there's absolutely no way a 36-pound child would be surviving. So that's the things that's the only way I really know how to answer what to expect because I'm looking at cell counts and I know what people are being told that they're getting in other places. So that's what I would expect out of cord blood. But I say that on the front end of this, that as we go down through this list, it's going to be the same. If it's not 4 million to 10 million cells, I'm not expecting to see a true therapeutic event.
And I know, we're going to get into this more, but I think it's a lot of it has to do with, like you're saying, stem cells are stem cells, but it's the process that is getting the different results.
Yeah, it's the process, and there's so many ways of processing this. And I spent a lot of time in the last couple of weeks kind of reviewing some of this other stuff. It's just so many ways. But typically, when you're looking at cord blood and you're looking at amnion and you're looking at bone marrow aspirate, those are typically very similar. So the reason I say that is these products are made across probably 10 to 12 different facilities across the US, and they're all using the exact same process. And if not, it's very similar. So I give you the difference in cord blood, go down these biological processes. BMA. BMA is something that is kind of the first thing that came out with stem cells, and they actually do produce a stem cell. Uh, you don't typically see a lot of effect with it simply because the typical BMA harvest is pulling out around 25 to 35 million stem cells. 25 to 35,000 stem cells. Sometimes you get double that if you can get 2 cc's out of it, but a lot of times it's absolutely under 100,000 stem cells. It is a very well known process, and it is a process that the FDA does allow you to use the word stem cells. The reason is they don't consider it a drug. And the reason they don't consider it a drug is because the actual medication that's given prior to the harvest is what pulls the stem cells out, and then they harvest them. Uh, but again, the cell counts are low. The problem with BMA, one, it's painful, but two, you can only do this 2 to 3 times in your entire life. Uh, and it's simply because you don't need to go in and pull bone marrow out of your pelvic region or out of your femurs to get this process done. So once you've done it twice, I've been told after 10 years you might can do it again, but pretty much most doctors will tell you don't need to do BMA more than 2 times in your life. Uh, Similar numbers. You know, if you were going to ask me, would I want cord blood or BMA? I'd tell you cord blood because you're getting the same numbers, but you're not having to go through the surgical process of harvesting. And there is a 17% infection rate with BMA harvest also. So that's something to take into consideration. But let's move down to amnion real quick. Amnion is probably the one everybody hears the most. It's injected a lot. Uh, it's sold as stem cells a lot, especially with orthopedic surgeons, especially with guys who are wanting to inject spinal injections, different things like that, joint injections. This is the number one thing that's being used across the U.S. is amnion. So let me tell you how amnion is produced. Amnion is one of the layers that comes out of the placenta at birth, and you have 3 different layers. And you take the layer that they use, the amnion layer, and they double fold it to get it thick enough. And then what they'll do is they'll freeze dry it, which is dehydrate it. Sometimes they'll wash it with acid before, which is an enzyme. That is why most people don't have liquid amnion anymore. Is the FDA came down hard on that about 2 years ago, because anytime you take a tissue and you flush an enzyme on it, it becomes a drug. And if you don't have drug approval, they're going to come down on you. And so moving forward, you take that amnion later. Well, what they're doing is they're basically freeze drying it in a dehydrator. Well, you and I have talked about this. Anything that's freeze dried does not have live cells in it. It's that simple. You just suck all the fluid out of it. So what happens is you're freeze drying it just like a piece of beef jerky. You're sucking all the fluid out of it. So the first thing that happens is the cells actually collapse and then explode. So you get it, by the time it comes to the patient, the doctor's ordered a cc or 2 cc's of it, which is relatively inexpensive. They'll inject sterile water back into it, reconstitute it, and make sure that it mixes up very well. And then they'll come and give you the injection. So that doesn't mean that amnion doesn't work. But typically, you're looking at around 50,000 stem cells or less in 2 cc's of amnion. So what's interesting, the FDA doesn't allow you to do is say that any of these products work better because they have live cells than the products that don't have live cells. You can't make that claim. So,
But that's true.
correct.
Okay.
So you can't make that claim. So I can sell you any of those three products, and you can say, well, doesn't cord blood have live cells in it? Well, if we stored it correctly, it does. Doesn't mean we did. Uh, you can ask on the bone marrow aspirate. You can ask on the amnion, But the reality is I can't say to the patient, "Hey, our cells are alive, theirs are dead, so ours are better." The
Right.
FDA doesn't allow you to say that. But it is interesting that amnion does work some on knee injections. It works really good on wounds, which is something that a lot of people are trying to get approved through Medicare right now is actually treating wounds. So you take that double layer of amnion that I was telling you about, and instead of mincing it up and put it in a bottle so you reconstitute it, they actually cut it in sections and you put it on wounds, and then you squirt the amnion fluid that's been reconstituted back on top of it and pack it, and it works pretty well for wounds. So that's kind of those three products, and that's what I think everybody's seeing the most. Uh, where it started was stromal vascular fraction, which is the SVF we on there. And the stromal vascular fraction is probably one of the better ideas. The problem is the FDA has labeled it a drug, and they're not going to back off of that. Um, and and it makes sense because the FDA says, look, you can't harvest a tissue, a structural tissue, and remove biological properties from it without creating a drug with both properties. That's just the rules they've had. They've been in place for 50 or 60 years. It's not going to change. And that's where everybody started. And they thought they would get the FDA to agree that, hey, fat is not structural tissue because it really doesn't structuralize under anything. But the FDA only has two categories, cellular and structural. Well, fat's never going to fall in the cellular category. And so what happened was everybody fell off the SVF wagon and started using the other three because actually the numbers, like I was telling you, the numbers are very similar. If actually not more in cord blood and bone marrow than you would get out of stromal vascular fraction. And that's kind of how the market moved there is everybody got just threatened by the FDA. I think it was 320, 312 clinics and labs across the US got threatened by the FDA. So everybody just shut it down. Well, then they started buying these products. Uh, and then there's PVF, which is what I developed, and we can go over that at a later time more. But it's similar to stromal vascular fraction, but in our process, we go in and just try to pull fluid out. We don't want to pull any structure at all, and so then we take that fluid and run it through a patented process to create our product. So that's really the products that the I guess the autistic world is looking at when they see these advertisements.
Right, right. So one of the things that when you and I were talking, because I'll just tell everyone, listen, I've been down these rabbit holes and I would get to where I would see so many different terms and claims that I honestly had no idea what was what anymore. And a
Correct.
lot of this can feel like that. And one of the things when Jory, when you and I first talked, that I found very interesting was, and you kind of talked to you hit on this at the beginning of where this all started with orthopedics. So
Yes.
I think it's important for you to just kind of in this section right here, kind of state why orthopedics are doing knee replacements and not stem cell therapy.
Okay. Um, Let me say that stem cells is unbelievable when it comes to arthritis. Um, but that's not why people are getting total knees. So I see these advertisements all over the place. Saw one out of Atlanta 2 days ago saying, why get a knee replacement when you can get stem cell treatment? Well, those are two different issues. Uh, Stem cells works with pain. An actual knee replacement, which I used to sell total knees, is not really based on pain. It's based on the fact that your bone structure has completely changed. And so, if you look at yourself in an X-ray, and your full body X-ray, your legs will be knock kneed, just like this. And you look at that, and you'll say that is not me, and it is you. But if you look and you're going in to do a total knee, and one leg's like this, and one's bent, this one needs a total knee. So what happens is the tibial plateau gets collapsed. It presses down. And once that happens, you're changing all the bone structure. Well, stem cells are not going to replace the bone structure where it used to be. There's no way that's going to happen for a lot of reasons. For one, you're still standing on it. And for two, that's not what they do. So when you go in to have a total knee, the doctor's not giving you a total knee because you have knee pain. He's giving you a total knee because your bone structure has changed. And what's going to eventually happen, once it goes straight and not like this, it's eventually going to go out. And when it goes out, you're going to start dislocating your knee. And
There you
so,
go, Pammy. Good thing you had those knees replaced.
correct. If you need them, you need them, you
Yeah.
know. Uh,
Yeah.
but let me tell you what's very interesting is we found that hips don't do real good with stem cells. Um, and the reason is the difference in the focal point in the hip. So when you have a hip, the hip is like a golf ball sitting in a socket. Well, the knee is like two golf balls sitting on a platform, and it can slide. Your knee slides all the time. Hips do not. Hips are locked into that spot. They don't come out. If they come out, you got a problem, like a real problem. So what happens is when your body is sitting on top of that golf ball, it has a spot that may be the size of the head of this pin that is causing the pain. And what's happening is that spot stays impacted against the other bone, and it never gets any relief. And so you can do a hip injection. It might work for a week, it might work for a couple of days, but within two weeks, the pain's coming back. And we've tried all kinds of ideas. We've worked with some of the best orthopedics on this topic, and they all came back with the same conclusion that hips are out. Hips are just for a hip to work, you would literally have to go non-weight bearing on that hip for over 12 weeks to give it a chance to work with stem cells. And we still at this point don't know that that would work.
So I'd like you to just in really simple terms, and we talked about this, how different things are marketed, but I just want you to talk about like in basic terms, somebody says to you, "Hey, Jory, what do stem cells do when they're put into your body?"
They are an anti-inflammatory. That's it.
Okay, so that's the simplest terms. Like that is I think that's what we all needed to hear, right? Stem cells
Yeah.
put into the body as an anti-inflammatory. And what I want you to know is in next week's session, Jory's going to go deep on the process in kids like ours and why the results that they're seeing and all of those things from the brain to everything else next week. But I think right now, just can you give us like a high level overview of how the stem cell therapies are created through the harvesting and the lab process?
For mine in general, or just different ones in general?
I think for what you're doing basically, because I will tell you in all the research that I did and everything that I went through, I felt like what you are doing through Neuro-Free makes the most sense to me.
Okay. Well, what we do is, I explained earlier that stromal vascular fraction is fat. And we realized a long time ago we were going to survive the FDA. We had to get away from harvesting structural tissue. So we started targeting how do we collect cellular tissue. So perivascular fraction is the term that I actually termed in the medical field, and that's where you find perivascular cells. Well, perivascular cells are the peripheral blood cells that are found in the fat that are kind of sitting there on wait. And when your body needs stem cells, they activate your perivascular fraction area to activate perivascular cells to release these peregrine factors and stem cells and everything into your bloodstream so you can heal. And as we get older, that happens less. So what we do is we take that process, we go in and uh, for this intents and purposes, we harvest from the mother to treat the child, and that's allowed with the FDA under our guidelines. If you're 18 years or older with other conditions, we don't. We harvest from the patient. So what we do is we go in, that person goes and sees an orthopedic plastic surgeon. That plastic surgeon looks and determines where they think they can harvest best on the patient, which is the belly, low back, or the thighs. And then we pull out typically around 260 cc's of fluid. Typically out of that, that gets shipped to the lab. And then what we basically do is we basically cold boil tissue. And I realized when I was in the biologics that heat would separate stem cells from tissue, but it would kill it also. And also pressure will separate stem cells, but also pressure kills stem cells almost instantly. So what we did is we just created a process to where we put these cells in a container. We put them over a sonicating head that creates sound waves uh, at certain levels of sound and sine waves, and on and off at different variants or whatever. And what we finally found was, hey, we're separating the cells, but we're increasing that pressure. So what we did is we put that in fluid, like with a radiator, and kept that temperature down. And then next thing you know, we're producing high numbers of cells. Well, then we take those cells, we separate them, and we determine how, and the physician determines this, how many actual treatments this person is going to get for this condition, which is typically 3 infusions or 5. And then we separate them that way and we store them. Uh, we are a little bit different on stem cell process. We don't call it stem cells, we call it cell therapy. And the reason we do is we let you know up front there's not just stem cells here. Matter of fact, the stem cells are the least amount of what you're getting in this process. You're getting peregrine factors, you're getting mitochondrial components, you're getting other fluids that just kind of support, and you're getting stem cells. And that's how our process works. When that patient gets treated, we have a piece of paper that's signed by a lab tech, and our lab's FDA registered. The process is under FDA registration that shows exactly how many cells you're getting and how many of those cells are stem cells and how many of those cells are live cells. So, no claims. This is what you're getting, and this is what you're getting today. Now, with that being said, it changes uh, what other companies are doing on these processes. So, like with cord blood, as I told you before, gets processed and it's put in a lab. Well, typically at the end of the day, when they get the 40 or 50 or however many they divide this into, what they do is very similar. They take it, put a storing agent in it, which separates the cells so they don't explode immediately, and they package them. Now, the difference in amnion and amnion gets irradiated. So the package itself gets irradiated, so it's sterile. Well, the radiation kills everything in the package. So we know there's nothing alive in amnion because it is processed different. And that's the difference in its process. So when you look at the different processes of cell therapy, BMA is done, it's never really stored. BMA is harvested while you're in surgery. They take that, they spin it down, mix it with the saline and push it into the vein or inject it or whatever they're going to do. That's how BMA is done. Cord blood, like I said, is very similar to what we do. The differences is if you're really getting a therapy that has stem cells in it, you should be receiving a piece of paper from a live lab tech signature that's showing they tested this product you are actually receiving that came out of this bottle or this package, and this is what you're getting. That is what's creating a lot of the confusion that we first started on. the different processes are different across the board. And I know that may have gotten a little bit confusing, and we can go back and answer whatever questions. But that's what makes this confusing is if you are receiving cord blood that you donated, then you might have something that tells you how much is in it, maybe not. If you're buying cord blood from a donor, then one, the patient needs to be matched to it, but they're not going to give you something that tells you that was tested and here's how much is actually in that bottle. Same thing with amnion. They're going to give you this bottle with amnion and they're going to give you estimates of what's in there. That's kind of across the board with cord blood, BMA, and amnion. You're getting an estimate of what's in there. They didn't actually test that bottle and tell you what's in that bottle. They're testing their process. And so when they first line up their process, they'll do 15 or 20 processes and do these cell counts. And they'll take one that they like or one that represents them, and they will say, this is how many cells you're getting. And so that's kind of the difference in how some of the processes are done. And that's why it gets a lot complicated. And it's why it's hard for me to come out and explain the differences in short term. And that's why we're
Right.
going to try to do this over three events is because it gets really complicated. And hopefully before we're done with this, we're going to alleviate some of that.
Right. And that's what I want everyone to know and understand that's here today. This was just the introduction to stem cells and the different kinds that are available and what people are looking at because we have families that are traveling to Mexico or they're traveling to the Philippines to
Yeah.
get these services and infusions and things like that, and maybe they're not seeing all of the results that they can. So you want to talk about the delivery methods? Like we talked about how you get it and that kind of, and just so everyone knows, just to be really clear here, when they, Jory, when they do it, when they go to the plastic surgeon to pull out the cell, it's like getting liposuction. That's kind
Yes.
of what it's similar to.
Very
So,
similar.
yeah, so that's why they're looking at your butt and your thighs
Yep.
as a mom.
And most women are happy to donate.
Right, exactly. I'm like, can you do the left leg too while you're there?
The girls in the lab will be like, "Hey, do y'all need donors?"
Yeah, exactly. Can you pull some of this out?
Oh,
Um, so yeah, so we've got on here, the delivery methods,
yeah.
infusion, injections.
All right. Well, let's start with the infusions. Um, there's very few companies that are. I don't know if there's anybody else in the U.S. other than maybe one person doing infusions, simply because it's risky. Uh, for one, it's like I said, you're infusing it into the bloodstream. So let me make that clear. You come in, you infuse it in the bloodstream. The problem is when you do infusions, if you do have high cell counts, it can clog up the lungs. We have a process that we get around, get through that. I don't want to say we get around that, but we have a process that we patented that helps us manipulate that so that we can get as many cells into the body as we can. The other is taking and doing what's called a push into the vein, which is where they take uh, the concentrated version and just put a needle into the bloodstream and slowly push it while you're pushing the plunger at a certain rate over 10 or 15 minutes and try to concentrate it into the bloodstream. If you're if you're really dealing with high cell counts, and when I mean high cell counts, I mean 5 million cells or higher. If I'm pushing it into somebody's bloodstream, I might kill them. So when you go out of the country and they say, well, you're getting 40 million stem cells or 20 million stem cells, and they're pushing it directly out of a syringe right into the bloodstream, there is absolutely no biological way you are getting that many stem cells. You're getting less than 500,000. So that's kind of the target that we're looking at. And I think uh, the injections are kind of what is getting confused is a lot of these companies don't necessarily tell you how they're delivering this. Some are injecting into the muscle, some are injecting into the joints, some are ejecting into the spine. Uh, we had a woman that called, I talked to her for quite a while. She decided to go to an orthopedic who does a spinal injection with the child. And I just think that's very dangerous, and I don't understand why they're doing that. But I helped her go along that route. That's the way she wanted to go. I mean, I'm supporting her either way. Other delivery approaches are like nasal sprays, very ineffective, if effective at all. For one, the cells are not alive. You can't store stem cells unless you freeze them at -80. And there's no way you're going to thaw out something that cold and spray it into your nose. Well, then you would have to turn around and put it back in the -80 freezer and freeze it again for it to contain live cells. So if they walk up and just hand you a nose spray, it's amnion, put freeze dried, reconstituted, put in a nose spray to spray into your nasal passages with the idea that they'll absorb through those organs and membranes inside your nose. That doesn't work. We quit doing that. Good Lord, we quit doing that 12 years ago on other things. It wasn't even anything to systemic levels like autism. So that's the most of what's being seen is injections, IVs, and pushes, and for the autistic world.
Yeah, which makes sense. So as we kind of talk about, I'd like you, because we're going to transition next week, we're going to really dive into the autism and the things that you've seen there in through what you've done, but talk about, just specifics on what makes neuro-free different than the other things that we've talked about. Can you just kind of give us a summary of that?
Yeah, I think it's simply the numbers. Um, so, like when you go out of country, you can't do this in the US. But what they do is they tell you, well, you're getting 60 million stem cells or you're getting 100 million stem cells. What's
Because
happened?
let me just sorry for interrupting, but my question is, so in like as a mom,
Yeah.
is it that the higher numbers the better? That's what we're thinking.
Yes.
Gotcha.
We know the higher numbers, the better.
Okay.
The problem is, well, let me tell you what we have. And then I can tell you what's being sold that's not necessarily true. Let's just say you come in and harvest, and we end up getting 60 million stem cells out of you, and we divide it into 3 treatments. So we know you're getting, or your child's getting 20 million stem cells per treatment. The difference is our patented process. We're not growing them. We're not expanding them. We're not developing them. We're not multiplying them. We harvested this directly out of your body, and we processed it with sound waves and different things. And this number was static. That's the number we got. That number's not going to change from that point forward. And we know the numbers are better. So we know in my world, if I give you 4 million cells of my product, I'm expecting a therapeutic event. So whatever I'm treating you for at that point, if I'm giving you 4 million cells, I'm expecting some results, some functional results actually. But that's not necessarily everywhere. But that's because when we harvest 60 million cells, we also have 8 billion other products in there that developed with that. So you got peregrine factors. I think now there's 134 peregrine factors that have been discovered that are all anti-inflammatory, anti-cancerous. All that is in there. So then you got like mitochondrial powerhouses and ATP and different things that's also mixed in there with that number. So I say that when you go somewhere where they expand them, uh, grow them, develop them, multiply them. They're taking, remember, we were talking about doing a harvest and you're getting around 100,000 cells. Well, they're taking that 100,000 cells and mixing it with an agent to grow and biologically get these numbers to double. And mitochondria, I mean, It's just biological. We're going to get these cells to double and triple and quadruple, and it keeps going. The reality is, though, is a cell can only multiply 2 to 3 times before it starts losing its factors inside the cell and even quits acting as a cell by the fifth time it develops. The second thing is the peregrine factors never increase. So if I take 100,000 stem cells that were harvested from you and I grow them to 60 million cells and actually do that, the peregrine factors did not develop. You still have the same peregrine factors as if you had only harvested 100,000 stem cells. And the stem cells themselves are not really 60 million cells. So if you started with 100,000, you probably truly have between 350 and 400,000 at the most, maybe 500 if it's a perfect situation. Never is. But they kept multiplying. So what you have is you actually have, let's just say 500,000, you have 500,000 stem cells that got divided evenly across 60 million cells. So I could have given you the 500,000 cells or the 60 million cells that I developed, and you would have got the same result. So that's the difference in what we're doing and what you see out there. Uh, it's almost impossible to take cord blood and amnion and grow that number beyond 2 or 3 thousand cells that are effective.
I gotcha. And look, for those of us that are not scientists, I just want to say that this is a lot of information. And so what I want everyone to know is, like I said, today was kind of an introduction into Rory's, you know, 500,000 to 60 million and all of that. Next week, we're going to build on this and we're going to talk about the connection between stem cells, the inflammation, and neurological conditions like autism. So, we're going to get very specific about what families should understand, as this field continues to evolve. I think that's really important. And I just like to I want to ask, we have some questions that came in.
Yeah.
So before we wrap up, I'd just like to ask you a few questions, the common questions that came in from families in our community, because I think that these are the questions that probably many of you on here have as well. So, when parents start researching stem cells, it often feels overwhelming, kind of like today might have felt for some people. So, if somebody says to you, "Hey, I'm going to start researching stem cells," what is the first thing families just need to understand right off the bat?
Understand that if somebody's trying to sell you a number, like, hey, we have 60 million stem cells, be cautious. I think that's the thing that's getting everybody is when you see somebody throwing big numbers, there's some stretch to that. I mean, there's just is.
That's
Uh,
great.
you
Because
know,
if they're saying, my numbers are bigger than yours are. So that's why
correct.
you need to go with me because my numbers are bigger than yours are.
Yes.
So the next thing is with so many, there's a lot of things that are being marketed under regenerative medicine, right? Besides the numbers, what are some other red flags that families should maybe watch out for? Maybe the nasal spray you talked about.
Yeah. The first thing I'm going to be cautious of is why are they calling it stem cells? Because I have more stem cells than anybody, and I'm not calling it stem cells. So the first thing that throws me a red flag in there is uh, when they say if I'm looking to be cautious, I would want to know why are they calling it stem cells and what are they actually giving me. That would be my concern. Uh, Most of these ads that we're looking don't readily come forth with that information. And anybody who's not open to your question is hiding something, in my opinion. There and know that depending on what you get, is going to be there's always limitations to all of it. So just be cautious, and autistic families are unbelievably good at this. But there's just a few things you should be aware of. First is the numbers. I've seen them go from 60 million to 253 million in 4 months. And it's all because it's a numbers thing. Second is be cautious of people using the word stem cells. Nobody is treating with stem cells. There's nobody that absolutely is treating anything with 100% pure stem cells. And most, if not almost all, more than 75 to 80% don't have live stem cells in their product at all. So those are the first two things I would be aware of.
Okay. Another question that came up a lot was regarding the different biological sources and why you say you're going to use the mom, for example. Why is one
Um,
considered better?
no, not really. Um, the mom typically has a better genetic compatibility when it comes to the product we're talking about. We can use the father, that's not a problem. We're a little bit more cautious with it when it's the father, and that's all. And usually the mothers have no problem with it. Uh, I've never had one that had a problem with it, except for a couple who had some medical conditions. We're talking with a lady right now. She just had a hysterectomy, so of course, uh, we're not going to do that. Uh, I just saw a post adopted parents. We can deal with that as well.
Yeah. Yeah, Pammy is actually that's who when you and I talked, I told her that I brought them up and actually asked about that and you had said that you could do that.
Yeah.
So the other thing too, so when you talk about for our kids specifically when we're talking about autism and you're pulling from the mom or the dad or whoever and infusing in the child, but when you're using it for other things from other people, you pull from them and put it back in them.
Yes. That
Okay.
is exactly. Now, hopefully, I do have a second patent filed, and hopefully, it's in the next 14 to 16 months, we will be able to use donors across the board. I don't know that we will be able to do that with the children for a couple of years. We'll see. But hopefully in 2027, we will have a drug that is where you just come in and get the donor drug, and we won't be harvesting from the patient anymore.
Hmm. Interesting. So I know there's a lot of parents asking, and I know we're going to dive into this more next week's session. But just as we wrap this up, can you just give us kind of a preview in what, you're observing in children with autism?
Yeah,
Just give us a teaser into what we're going to hear more about next week.
yeah, we've talked about that a good bit. We see a big change in anxiety, comprehension, uh, connection, eye contact is big. Um, those are the big gut issues. Wow. I mean, the gut issues may be the top. It's that's one of the things we discussed last week after that symposium we went to or I talked at. I've forgotten how much the gut issues get resolved, and gut and anxiety may be the top two. So what we are doing is, and you and I have talked about this, and I worked on it some today while I was driving. Um, we have developed an AI data collection system, and we are from all intents and purposes, from what we can tell, we're the only company in the world that has actually put together an AI data collection system that's going to collect true empirical stratified data that we should have available somewhere around the first of the year, hopefully in October, maybe in January, to where I can actually answer this question with true data that has come solely from the parents and the families and the results that we can answer these questions. But that's the few things we see that's kind of across the board. Uh, there's always this, seems like there's an attempt to start communicating if most don't start talking. I don't want to throw a number out there,
Sure.
but I don't know of many children that we have treated that have not started using words at some level, and typically within 30 to 45 days.
Yeah, that's amazing. One of the things when Jory and I talked is, it's very hard to give uh dynamics of what happens because all of our kids are different, right? Every single one
Yeah.
of them is different. So it's not like, we have inflammation in, our right arm and we're testing that right arm inflammation on all of our kids. Every one of them is different. And when him and I were talking, he was saying something about we were talking about percentages and I said, "Well, Jory, you need to understand like for us as parents, if somebody told me I could improve Jordan's, social anxiety 30%. That's huge to us." And he was like, "Well, I'm not okay with 30%.
I'm not.
Like 30%
I'm
is
just
not good."
not.
And I'm thinking, well, 30% in our world is incredible. So listen, we're going to dive deep
Yeah.
into this, into our kids next week, and talk more specifics and get more detailed in that and their process. And if you have questions, please email them to us because
Absolutely.
that's what I'm doing. I'm gathering questions so that we can answer your questions directly on this. So
Yeah, I
next
mean, well, I'll give y'all, everybody that's listening, I'll give you an example. Well, 2 weekends ago, I went to a symposium and did a presentation. And I don't like doing presentations. It's just not who I am, but I do them. And it was supposed to be a 20-minute uh, presentation with a 10-minute Q&A, and it was live Q&A. The Q&A went over 2 hours. So if you have a question, I'm all about trying to answer your question. And if you feel like I didn't answer it, like I say, send it in to Shannon and we'll address it.
Yes, it's info at notyouraverage.autismmom.com. Send your questions because that's what we're here for. That's why we did this. And the thing is, you don't have to figure all of this out today, right? You don't have to figure it out right now. You don't have to have all the answers. But I think that what's important is you do deserve to understand what you're hearing so that when you're making decisions for your child, you're doing it from a place of clarity, not from a place of confusion. And that's exactly what we're going to keep building on in the next two sessions. Our goal with this series is simply to help you better understand this topic so that you can make informed decisions for your family. So, Jory, thank you so much for, your great information today. And I hope that all of you will join us for the next two sessions. And again, if you have questions, specific questions, email them to us because I'm really glad you're here learning alongside us.
I appreciate it.
All right, Jory, thank you so much. Thank you, everyone. And like I said, we'll dive in even more next week. Thank you. Thanks, Jory.
Thank you.